Welcome. This is the part of PA211 Day where we're going to talk about Alice. Alice is an initiative that our United Ways launched in 2018, and we have been really pushing this and learning about it and really using it in different ways in lots of different communities. So I wanted to go ahead and let everyone know we are in meeting format, so we can talk and see each other. Please make sure to keep your microphones off just in case. And if you have any questions as people are talking, please feel free to put them into the chat. My name is Amanda McNaughton. I'm with United Way of Pennsylvania. I'm the Member Services Coordinator. United Way of Pennsylvania is the statewide association of local United Ways. And we're the ones that kind of brought the Alice report into Pennsylvania and kind of with the partnership of our local United Ways, pushed it out across Pennsylvania so that we could use this really exciting tool to really do a lot of great things with. So I'm actually going to turn it over and let both of our panelists today introduce themselves. And we'll go ahead and we'll start with my colleague, Rebecca O'Shea. Rebecca?
Hi, everyone. And I actually want to correct you, Amanda. You are the membership manager because you were promoted last year. So just wanted to call that out. But I am Rebecca O'Shea. I am the Advocacy Engagement Coordinator at United Way of Pennsylvania, which basically means that I work a lot on public policy. Gail, go ahead.
Hello, everyone. My name is Gail Young. I'm the Executive Director of the United Way of Lawrence County, and I've had an extensive career with United Way for 32 years. Prior to that, I was with economic development, redevelopment, and community development in another community. So thank you all for joining us.
Thank you both. I'm really excited to talk to both of you and see what we're going to do today. First, I wanted to let Rebecca give a little bit of an overview about what Alice is and what Alice shows us about Pennsylvania. Rebecca, I know you wanted to share your screen. Excellent. It is coming up for me. If anyone has any technical trouble, please put it in the chat, but I think you're good to go, Rebecca.
Sorry, I need to unmute myself. Okay, hello everyone. So I'm gonna go ahead and start and give our typical presentation that we give surrounding Alice and the topic of Alice and really understanding who this community is. So to start, let's meet Pennsylvania's Alice population. So when we talk about Alice, Alice refers to the population that is living below the federal poverty level. Above the federal poverty level, but below financial stability. The actual term of Alice stands for asset limited income constrained employed. And the way that we measure this Alice population is through what we call a survival budget. The survival budget is a good measure of the cost of bare essentials to survive in Pennsylvania. And then we also have a stability budget, which is a little bit better measure, and you'll see that in the numbers. But with that being said, I like to put out there that neither the survival budget nor the stability budget are truly the goal, and you'll see that in the numbers. It's very expensive to live in Pennsylvania, and so the survival budget and the stability budget break that down. As for United Way, our goal is to engage with businesses, government, nonprofit partners to work on solutions that help Alice move to a path towards financial stability. So who exactly is Alice in Pennsylvania? It is nearly 1.4 million hardworking Pennsylvania households, or 27%. So again, their income exceeds that federal poverty level, but it's not enough to survive. So when you add that to those that are living below the federal poverty level, you're looking at nearly 2 million households in Pennsylvania, or 39%, or 2 in 5 households, however you want to frame it, that are struggling to survive. It's important to note that Alice is in every single community. They can be our neighbor, they can be our friends, our family, those that are local community gatherings. They are everywhere, and they are a huge essential part of our population. So we also like to talk about Alice in terms of demographics and breaking down what exactly that looks like, be it based on race and ethnicity, family structure, age, things like that, to really gather our sense of who this ALICE population is. So you can see here that Black and Brown households are disproportionately ALICE. You can also see that younger people are disproportionately ALICE. So this is really essential when we're talking about different types of programming to do in our communities, as well as public policy to better target this population. So I talked a little bit about the household survival budget, but this is how it stacks up to the federal poverty level. And you can see here, so these are based on 2018 numbers. I do want to point that out. And you can see that the survival budget is nearly double that of the federal poverty level. So that is the basic cost it takes to survive in Pennsylvania in these communities. So you can see also that we have a senior survival budget, which helps inform us, as Pennsylvania has a very large senior population, what our seniors are struggling with in order to survive. The survival budget, the senior survival budget, includes lower food costs, traveling fewer miles, and spending more on health care, which makes sense for seniors. Seniors do tend to eat less, they travel less, and they do spend more on health care. So it's really unique to have that adjusted view of what it takes to survive for our senior population as well. So here is a really great graph to take a look at how the survival budget stacks up against a typical salary in Pennsylvania for an ALICE member. So here you can see that the retail salesperson is making about $11.08 per hour, and that is still not enough to cover the single household survival budget for a single adult. If you take that and you look at the family of 4 here, you can see how different line items break down in the cost of what you need to pay in order to survive. One thing that I like to note when looking at this graph is how conservative these numbers truly are. My favorite thing to point out here is housing, $894 a month for at least a 2-bedroom apartment for a family of 4. It's kind of hard to understand where that can be found in Pennsylvania. Again, these numbers are based on 2018, but that still kind of reflects how conservative these numbers are. And yet we still have nearly 2 million people that are struggling to survive in Pennsylvania. The other thing that we like to talk about in terms of ALICE is how the economics behind it stack up. You are hearing a lot in the news about inflation and consumer price index and the rise that is happening in our nation. One thing that we like to point out is that the CPI isn't actually an accurate representation of what household costs are. So because of that, we have introduced the ALICE Essentials Index, which, as you can see, is nearly double what the consumer price index is when evaluating what basic household goods cost in this country. So that is just something that we like to call attention to in a lot of our advocacy, because it is important to note that a lot of our government assistance programs and other types of community programs are based off of inflation rates, are based off of the CPI as the accurate measure for the economics behind poverty. So when we come in and we say, well, actually the CPI isn't that accurate, check out this ALICE Essentials Index. It helps conceptualize what it truly means for the cost of living in Pennsylvania and across the nation. So ALICE is truly the backbone of our economy. And one thing that I like to point out is how the Pennsylvania economy is broken down. We break it down into innovators versus maintainers. Maintainers occupations are those childcare workers, there are teachers, there are, those are the nurturers, the nurses, infrastructure, they are working on our infrastructure, building up our state. They truly are what our economy is consumed by when it comes to jobs. And you can see here that most of those jobs do not pay a financially stable wage. You can also see here in this chart for figure 6 that low wage jobs have increased in the last decade by, I believe, 76%. That is important to know when we're talking about what financial stability looks like in Pennsylvania and why it is so hard to achieve financial stability for families. The household stability budget is another form of what we like to talk about when it comes to financial stability and this ALICE population. You can see here that the household stability budget is a little bit higher costs for things to be considered financially stable. Even with that, you can see here that the cost of housing for a single adult, so a 1-bedroom apartment or a studio apartment, is still $875 a month. That is a very conservative estimate. So one thing about the stability budget is that it does add this savings line item as well to ensure that there is a financial safety net for this population. So this is just a general idea of what stability can look like in Pennsylvania, but it's still conservative. The reason why we talk so much about ALICE is that it is essential to raise this population to financial stability, to that ALICE threshold of financial stability, because it is economically beneficial for our state. You can see here that when you raise that population to the ALICE threshold, you're getting an added 130.2 billion per year to the Pennsylvania GDP. That is serious money for our economy, because we know that this ALICE population spends the money that they receive. Earlier in the day, we had Senator Casey speaking about the child tax credit and how it lifted, I believe, 40% of Pennsylvania households out of Pennsylvania children out of poverty. That is huge. And the reason why we know that tax credits like CTC and EITC work is because that money is being spent and is going to help the people that need it. And that is where we see the multiplier effect and the economic benefits for those types of programs. So you may have noticed that a lot of this data is based on 2018. The reason for that is when we refresh the data. We were going to refresh this year for 2020, but the data is based off the American Community Survey, and the Census Bureau actually dubbed 2020 ACS data as experimental. So we haven't been able to refresh it since 2018, unfortunately. In the meantime, we did decide to conduct some COVID-19 impact studies on Pennsylvanians to get a test sample of what was truly happening throughout COVID-19 and for this ALICE population. The first study that we conducted was in August of 2020. So that would have been 6 months out from the initial start of the pandemic in March 2020. And one thing that we noticed is that 70% of respondents indicated changes in employment. This reiterates the point that ALICE is of that essential population when it comes to workers. So they were our childcare workers, they were our retail workers, they were our grocery store workers, and that for a time being, a lot of them had to lose their jobs because of the shift in what happened when things closed down. So that was a very eye-opening statistics to hear back from this survey. We also saw that 77% of respondents had 1 month or less of savings to cover basic household bills. This is really important because one of the things about this ALICE population is that they are one financial crisis or one emergency away from falling into poverty. They don't have that saving safety net. And when you're living in a pandemic that we initially thought was only going to be 2 weeks, maybe a month, maybe 3 months, now it's we're 2 years almost into this. Not having a financial savings safety net is detrimental to this ALICE population. We also looked at the types of top concerns, and one of the biggest things was regarding housing. Housing is a huge issue, and we've seen that especially in our 211 calls. Today is PA 211 day, or just 211 day in general, and we've been talking a lot about 211 and the impact that has happened over the last 2 years. And our biggest request has been regarding help for housing. So we know that housing is a continued concern for this population, and something that we need to address as community leaders and legislatively. We also saw food insecurity, lack of internet access, and childcare and utility burdens. The second COVID survey that we conducted was in March of 2021, which is a 1 year now look back at the pandemic. And in that, we saw pretty much similar numbers: concern about paying housing for the Alice population, concern about debts, concern about loss of jobs. But one of the biggest things that occurred that was a huge shift between the 6-month look and the 1 year look was mental health concerns. Mental health has become a huge priority for, I think, everyone, but especially this Alice population. The last 2 years have been tough, and poverty is tough. So again, addressing mental health is a multifaceted approach that we need to look at different types of programs and policies that address poverty, which can really contribute to poor mental health. So that's just something to flag for you all, and definitely something that we have been working on with PA 211 to connect people to the resources and information that they need to make their lives better. The other report here is from our national group. The Alice Project is based out of United Way of Northern New Jersey. And so they actually did a national review of what occurred from the pandemic. And again, you're seeing a lot of the same exact story that we heard in Pennsylvania. The Alice population is struggling to get by. They're quitting their jobs due to lack of childcare. They lost their income, and they don't have a saving safety net when an emergency hits. And then, of course, mental health has been a huge barrier and just terrible thing to overcome and deal with in the last 2 years. So that is basically everything that I have on Alice and this wonderful community that we support and advocate for. And I truly recommend you all to check out our uwp.org website and our Alice Hub. There's a lot of great information on that website, along with a simulation that allows you to practice or simulate what an Alice experience is. I will say that it is stressful, and everyone that I have allowed them to or have offered this simulation to, their initial response is, how do people do this? How is this a thing? And so I definitely recommend that you take that simulation to truly understand what's going on with this Alice population. That is everything for me in this presentation.
Thank you so much, Rebecca. We do actually have a couple questions. Sarah, is it okay for me to take questions on the data now, or would you like me to hold them for the end?
You can take them now.
All right, Rebecca, first question. Can you briefly cover the different components inside the Alice Essentials Index?
Yeah, so I think one of the biggest changes is it includes more household items compared to the CPI. So you're looking at things like housing, childcare, food, transportation, healthcare, and a smartphone plan. The CPI truly only tracks inflation based on select number of items in that are being tracked for inflation, but also CPI only tracks certain metropolitan urban areas, which can kind of sway the data in an inaccurate representation of what cost of living is. Whereas the Alice Essentials Index is more specified to encompass all that the survival budget includes when it comes to cost of living, if that makes sense. I don't know if that was a really good answer or not.
I will say that we link to the uwp.org Alice site. I can also go ahead and link to the United for Alice national site. United Way of Pennsylvania's site is really a great hub for state data and also the basics. It's pretty much the gist of what you're going to need to explain this to people in your communities and to like your neighbor. But there is actually a very big national research hub where you can go in and pull all sorts of data from across the United States and every state that has an ALICE report. And I believe that they have a pretty comprehensive breakdown on the ALICE Essentials Index there as well, if you want to dig more deeply into it. And Rebecca beat me to it and put it in the chat already.
Yeah, it's hard to explain without getting into the weeds of the economics behind it, but I would say that the biggest difference is ALICE Essential Index includes more budgetary items to evaluate off of, and it includes the urban versus rural data.
All right. Thank you so much, Rebecca. If you have any more questions on the data, feel free to put them in the chat as you think about them, because I do believe we have time for questions at the end of the session. So we can come back for that and really put Rebecca through all of her paces so that she can do that. But I wanted to go ahead and introduce Gail Young again, who's going to talk about how we took this data from the report and really implemented it in our community. So Gail, whenever you're ready.
Okay, thank you, Amanda, Sarah, and Rebecca for providing the information, the platform to talk about ALICE. I mentioned before about my background being involved in community development, redevelopment, and economic development. And I know when I first came to the United Way, I could never understand why they never worked in partnership with a lot of those agencies and organizations. And back in the day, we would call our ALICE families our working poor. And growing up I'm from a large family, a family of 9, and we were the ALICE family. I could never understand why there were 9 of us, but plus my parents, and we never qualified for any of the programs that would help families. So I can identify with this personally as a person from with that background, and also a person of color. Something that's unique with Lawrence County is we're a very small county and very rural areas that we have within the townships. And 44% of our population pre-ALICE pre-COVID were actually ALICE families. So we know that number is a little bit higher as we're moving in today. But what I love about ALICE, it gives us a platform for us to share with our legislators. And we're really working through the issues with transportation, housing, number 1, transportation 2, and mental health services, because they all go together in lifting our families out of poverty. I explained to some of our legislators some of the programs that they have designed are actually designed to keep families in poverty. And we have to partner with them in order to lift them up, but through education and training, workforce development. The way I explain ALICE in our community, I said most of our ALICE families are working families that have a side hustle. They have some type of a side job. They may be doing car detailing, haircuts, something on the side to survive. And we want to get them to a sustainable budget. So I said, they're already doing the hustle. So how can we work with them through education and training to get them to the next level? Another example of an ALICE family, because sometimes we need to put those professions into something that our community can understand. I did a presentation at our Rotary meeting, and clergy were saying that we're ALICE families. Sometimes we forget about our professionals, our social workers, our small businesses. They're ALICE families. So there's more people that are in that ALICE population than just, because so many times our mind goes to someone that's on assistance, and that's not true. But especially in rural areas, and most of us are from those communities, I know that housing is a major issue. And our county is so small that we don't have an agency that deals with housing. If you would bring up a question about housing in our community, they're going to take you to the housing authority. So you can see all the work that needs to be done. A few years ago, our United Way partnered with the city of Newcastle in receiving homes dollars. So we were able to rehab homes and working in partnership with other organizations and sell them back to families at market rate. So that was one way we were able to get families out of poverty. And so now we were working on a piece where we're actually holding classes for 5 weeks classes on training people on how to clean up their credit, getting them ready for home ownership. So I think it's an exciting time with Alice. It kind of opens up the door for us to speak to non-traditional partners, like looking at our township supervisors, because they received a large pocket of dollars, and working with them. We're looking at putting a program together with them to work with our families that are in trailers that choose to live there, but there's no assistance. So looking at starting assistance programs for, because they are taxpayers, they're paying taxes to your municipality. So how can we help them by providing a program that repairs their trailer so that they can stay in that school district where they choose to live? So I see all the opportunities that are coming about through Alice. And so, like I said, I'm really excited that United Way of Pennsylvania decided to use this model. As soon as it came out on it, we jumped on it immediately because I could see where it could make a difference in our community. Plus, it gives us the tools that we need to talk to our legislators, our school district, our hospitals. So it gives us another tool that we can use as far as United Way. We're not just raising funds, but we're also lifting families out of poverty. And I don't know how much time I have, but I didn't want to take up too much time in case we have some questions. So hopefully that's a good overview on how with 211, the tools that we have there, because that gives us a monthly needs assessment. So that's one tool that we have. And then the Alice numbers gives us another tool. So using it in campaign and providing that voice, being the voice for those families in our community, I think it's a natural fit for United Way. So I'm going to be quiet here and take any questions or any other things that we have to discuss. Thank you.
You have any questions, you can go ahead and put them in the chat. I do actually have some questions here for both of you, and I wanted to kind of guide a little bit of discussion around what we have done and what we could be doing. So I think one of the first questions we really want to talk about is what makes the Alice report different from other reports out there, and what makes it useful in our communities. So that feels like a two-pronged question. I think the first part of it is probably best answered by Rebecca, and I think Gail already answered a lot of it, but you might have more to say. So I'll go ahead and turn over the first part to Rebecca.
Yeah, so one of the things that I would say makes this different than other reports is that it really breaks down a story that I think we all know or have at least experienced at some point in our lives. I think about Alice and refer back to my time in college and being a broke college student, struggling to survive, working, serving tables on the weekend, interning full-time and taking classes full-time. It was hard, and it was constantly a hustle to try and cover my bills. That is something that is a very real life experience. And that is what this Alice report does beautifully to tell. It also shows the different breakdown of the survival budget and shows that the cost of living, and truly tells that story of struggling to survive, especially in Pennsylvania.
And Gail, do you have anything to add?
Yes, I wanted to share that I did share the Alice report at our women's conference about 2 years ago. And it was interesting because I had this slide that breaks down the Alice numbers for the municipalities, because so many times they think, the poverty is in all the cities, but it's not. It's not. So it dispels a lot of myths that are out there about our Alice family. So having the breakdown by zip code, when you have the zip code by 211 report, and you also have the Alice numbers by municipalities, it gives you a stronger tool that you can use to appeal to our legislators so that they see it. It's not just a city, it's all over.
So I think that kind of leads into our next question, which is, how can we use this to advocate both in our communities and across the state for Alice? So what can we do to push for solutions for Alice, statewide and locally? Whoever wants to take it first.
I think I can take it. Like I said, it gives us another tool when I meet my yearly visits with my commissioners, when I'm meeting with my mayor. It gives me another tool that I can use to show what our community looks like. And now what's interesting, it seems like I'm the go-to person when people want to know about our community. They're like, go see Gail. She can tell you everything about United Way, can tell you everything about our community. So a lot of times as United Way, I bring this up, we're not invited to the table where a lot of these decisions are being made. And it gives us the wherewithal or the tools that we need, because we can bring up our Alice numbers, and now our legislators know about it. You know, my senator knows about it. And United Way of Pennsylvania does a phenomenal job on their website, breaking it down by their districts as well. So I just keep speaking that language and repeating it. So it's in our press releases. We're always, whatever we're talking about, we bring it back to Alice. So whenever they see me, they're understanding this. So I think the more that we promote it in every area, especially around mental health now, I think that's very important. I had a woman that showed up in my office. This is right at the beginning of COVID. And I could tell she was distressed. And so, because our offices were closed, but I let her in. And she lived in a trailer, and she had pictures where it was actually falling in. And her church had helped her. And she was looking for, there's no place to go for service. And we don't have anyone that can help with us. So it opened up the door for me to talk to our mental health services, as well as our commissioners. We have to have a program for these families. The reason why she's having a meltdown is because her house is falling in. And I think we have to make it real to our legislators. So the stories are very important, because they're not getting this information. So we have to put a face to the story, and giving them the list of all the trailer parks that we have in our county. We were working with our CAP agency about 3 years ago, and their needs assessment came out, and it was showing that families were spending anywhere from 60 to 80% of their budget in housing. And I was able to take that along with our 211 numbers, and that was when we were just getting started on Alice, to our commissioners. And they were able to do it, to pay for a needs assessment for our county. But we found a lot of other information that came out there, that about 12,000 people leave our community every day to work somewhere else. I said, Commissioner, that should be a red flag for you, economic development. So it opens up so much more conversation and discussion about job training and workforce development. And that's who we are, United Way, where we're covering all those aspects in the community. So I think it brings United Way, it helps United Way get to the table, or brings us to the table where we can share those stories. Okay, I'm going to be quiet.
I actually have a question that's really good for Rebecca that came in through the chat. And
before we get to that, I just want to say that I absolutely agree, Gail. The storytelling element is so essential. I think as policymakers, we get too into the weeds of the the legislative language and the law and the particulars, and it can get so heavy and distracting as to what we're actually talking about, which is making a difference for the people in our communities. And so the Alice report really takes the story out of the weeds and say, no, this is how we're impacting people. These are the numbers. This is why we need to target this population. So I absolutely agree with you, Gail. Amanda, sorry to cut you off.
It's okay. And honestly, I'm seeing in the chat, there's a lot of people coming in saying that this resonates with them. And I think that it's also this is a session for nonprofit staff and volunteers and people who are helping others in their community. And people who help others in their community are Alice. We've discovered that. So that is also a really good point, and things that I'm seeing come in through the chat. The question that I think you'll really take off with is there a specific solution we should be promoting to legislators? So go ahead. I know that you have something ready.
So yeah, I mentioned during the presentation, child tax credits and earned income tax credits. One of the things that we are pushing at United Way of Pennsylvania is a state earned income tax credit, which is essentially a tax credit for the income that you earned. It is one of the most successful anti-poverty programs in the United States at the federal level. And I believe we're up to 28 or 29 states that have their own state EITC. So it's a policy that works. One of the things that we're really pushing out regarding earned income tax credit is that for every dollar spent on an earned income tax credit, it is $3 back in economic benefits and then $4 back in social savings. So that is huge for our economy because again, hitting on that point about the ALICE population, they spend this money because it's going to things that they need. So it could be to spend on that tire that is going bald and you know you need to replace that tire, but you just don't have the money for it. It could be to spend on an online class to better your education, to improve yourself so that you can advance in your career. They're spending that money, which is so essential for our economy and for this population. I also want to note regarding PA 211, PA 211 is such a great resource for this ALICE population as well. You dial, you text 211, you go on to 211.pa211.org and you get connected to information and resources that are so essential to your survivability in Pennsylvania. So we're also doing a lot of advocacy around funding PA 211 because that is a real-time resource for this population.
Gail, do you have anything specific that you've been advocating for locally?
What are our legislators going to do with all this money? Yes. So providing some suggestions or ideas, what we can do based on our, and once again, on the ALICE families, keeping that in their forefront because they have a chance to make a difference. We're also partnering with the EITC because I think that will help lift families out of poverty as well. Some of the public policy things that I've talked to my legislators about, because we have families that are maybe working in the fast food industry, that they have an opportunity to move up to management, but it kicks off their health care and child care. So really looking at some ways that we can maybe look at only having them for about 2 years, that they can at least keep their health care and their child care until they're able to financially be lifted out of poverty, because we penalize them anytime they try to advance. That's what's happening. We're seeing in our community. And I bring that to the attention of our legislators repeatedly. And because, they're so concerned about job turnover and we can't find people to work. And I said, well, there's a lot of barriers out there too. And I said, a lot of your government programs just don't work. They don't work. So I suggested, I said, I think United Way of Pennsylvania can kind of help you when you're coming up with deciding some of these programs that you're putting out for, because I said they have a pulse on what's needed it's statewide. And I said, if you bring them to the table, once again, bring us to the table. We can help, we can serve, we can be a resource for you. So I really think just staying in touch with our legislators, building that relationship, I think that's so important. So we're not just there when things are on fire, but they have a relationship. We have a relationship with them so we can bring up these issues and talk to them in a civilized manner.
Yeah,
Thank
and
you.
I absolutely want to note on the fact that we are nonpartisan. We do not care what party is suggesting the solutions. We just want the solutions. We are advocating for our communities, and we want to make sure that the policies that we enact as a state target this ALICE population. ALICE is often overlooked because most government assistance programs do not encapsulate that income range for this ALICE population. So they're struggling to survive and not being able to access the assistance through the government programs that we have.
Actually brings up my next question. Thank you guys so much. This is a great panel to moderate. So how do we make things more accessible for Alice? How do we get the services Alice needs to them?
I'll go ahead first. I was with a group that did a tour in Sharon, Pennsylvania. They were able to open up a Manchester Guild. That's a phenomenal program that works with the arts, and started by Bill Strickland in in Pittsburgh. And there's 10 sites now all over the world. And we have one in Sharon where they offer free training for EMT, different starter jobs. And in our community, also a beautiful arts program that goes along with it, with pottery and music, everything that's there. But there's no transportation. Once again, housing first, transportation second. There's no transportation between the two counties. So any individuals from Lawrence County that would like to participate in that program, or the Laurel Institute that does culinary, there's no transportation to get them there. We also I had an issue because our Latino population increased 78% over the last 3 years due to Hurricane Maria. So that's a big culture change in our community, especially with the second language. And so what United Way did, we had to start ESL classes because the classes offered by the state were too advanced. A lot of these family members are reading from a third or fourth grade Spanish level. A lot of them are from the townships, not from San Juan. So I have to make sure I tell people that all the time. So they ended up in our community because we had affordable housing. Housing was available through Section 8 in our area. So that's why we have a large influx. But meeting the needs of that community has really turned things around, because we had no Latino agencies to take that leadership role. So those are some of the things that we had to do. But I'm really getting back to this point. We all have to speak the same thing. When I'm meeting with my agencies and businesses, transportation. We had a family that wanted to start working at one of the local hotels in culinary. Our bus service doesn't start till 6:45. She needed to be there at 5 a.m. So, like I said, sometimes we have to really look at the barriers. I'm bringing the corporations to the table along with us. These are barriers. It's not that people are lazy and don't want to work. Transportation is a huge barrier in bringing families out of poverty. So it puts United Way in a different realm. We have to really look at all the spokes in the wheel: mental health, transportation, healthcare, all of this. So it gives us a lot more information. That's why people come to us as a go-to, because you have your pulse on a lot of things that are happening in the community. Okay. All right, Rebecca.
I agree with everything. We at the state association, we focus mostly on public policy, and that's all great and everything. But the true impact is in our local United Ways and the community programming that you all are doing. We take our cues from you all. It could be the revolving car loan that I know a couple of our local United Ways have programs around that will push us into transportation advocacy. It could be financial stability that pushes us into this earned income tax credit. Childcare is a huge thing that we have been advocating for over the last couple of years, because lack of childcare is a barrier to that workforce. So I would definitely say, there are ways to tackle this that's multifaceted. There's the policy approach, but truly the impact is at the local level.
So I think we're going back to another excellent segue here. So when we talk about legislators, who are we talking about specifically? Who has the power to really make a difference for Alice? And is there a specific government official we should be reaching out to? Who is in charge of budget and funding and advocacy? So who should we advocate to?
Yeah, so there is, obviously you can advocate to your state representative and state senators. A lot of our advocacy and calls to action that we push out are targeted at the state legislature. And you can actually, if you give me a second, I can show you how to figure out who your state legislator is and what district you're in and what the Alice numbers are for that district. So that is one form of advocacy, but I am also a huge advocate to vote vote, get out the vote, and vote locally. Local legislators, county commissioners, things like that, they impact your day to day. And so making sure that your voice is being heard with your county commissioners, with your school boards, with your whoever is a local leader, will impact the day to day of your community. So I will go ahead and put in the chat the legislative district tool that will help you find your legislator. But I recommend utilizing calls to action that we put out and to connect with your local United Ways, see what kind of advocacy that they're doing.
And I would just like to add that we are all our brother's keepers. So my mayor, city council, like you said, the local people, my state representative, my senator. So I'm always reaching out to them. If I can't get to them, their staff, because just to tell, once again, telling them the stories, what's going on through our Chamber of Commerce, when they have their legislative day. I want to know, what are the questions before? So I can make sure that that I'm there. If I can't get to them before, to give them some information on our local community. This is what we're facing, because I understand our legislators are overwhelmed. They have a lot of things that they're making decisions on. But if we're able, as United Way 211, to provide them with some of the facts, I think it will help them understand and their decision making on why we feel so important about EITC for state, why we feel so important about childcare, and another thing, like with the Latino population, it's the fastest growing population in Pennsylvania. And for those of us that are on the western side, a lot of the families are migrating from the east to the west. And in western Pennsylvania, we are not prepared. We do not have Latino nonprofit agencies. We are not prepared. We don't have a lot of employees at social service agencies that are bilingual. So this is, I'm screaming this to my legislators all the time, because there's no funding. They've helped me search for funding. There's no funding. So this is why, as United Way, we had to create this. Now we're looking at creating a CNA program, because we built a new nursing school in our community with no bilingual staff. So United Way may have to start a basic training program similar to Congreso that we don't have in our area. So we're looking at other ways that we can bring that into our community to help this new culture. So it takes us out of our comfort. I've been out of my comfort zone for about 30 years. And as United Way, we should be used to it by now. We should be used to it. But building those relationships, that's key. You got to go when you don't want to go. You got to be there when you're tired. But it's important, because you are the voice for your community, especially Alice community. You are that voice.
I will say, and thank you, Gail, like you're really killing it. You are hitting all the points today. But I will say, before I first started getting into advocacy, I was intimidated by legislators. They just seemed like someone so high up and powerful, and they would never listen to me. That is not the case. They are public servants. They are from your community, especially from the state and local level. And so reaching out to them should not be an issue. During one of our 211 conversations, I believe it was the second session today, we had legislators on who talked about people reaching out for help all of the time, and how they would often direct them to 211, but there was that relationship that they built with their constituents, because they value their constituents. So reaching out to your local legislators, I highly encourage. If you have an issue that you want to bring to their attention, such as advocating for this Alice population.
Oh, something else I wanted to mention, excuse me, is League of Women Voters. I'm very engaged with our League of Women Voters, voter registration, become a member. Every United Way, become a member of the League of Women Voters, because that's another way for us to get our information out, because they can speak for us. It's not just United Way speaking with the legislators. They can speak for us, because a lot of the issues affect women and children. So they have a passion for that. So don't forget those small groups that we can reach out and partner with.
So I know that we are running towards the end of the session, and I think that turning towards what comes next in our journey is probably for the best as we talk about what is the future of Alice? What does the path forward into financial stability look? And how can we help Alice get onto it in our communities? So what are our next steps?
I think as far as United Way, I know I really appreciate United Way of Pennsylvania getting the numbers and everything in place for us and providing that extra tool for us. But I'm linking it strongly with economic development, because I think that workforce development is a huge piece. And I think if we can also keep it in the forefront of all those other areas, transportation, economic development, how it does impact our community if we're able to prepare people for the workforce and to prepare them because for manufacturing companies moving in. Because I let our legislators know, our economic development know, no matter how glossy your presentation is, they're looking at the Alice numbers. Okay, go ahead, Rebecca.
One thing that I've been saying since the start of the pandemic is that we truly are at a turning point, I believe. I think more and more people are aware of the impact of poverty and the impact of not being financially stable. And so it's generating a lot of interest and excitement about economic policies and programming that will benefit our communities. So I would say next steps is definitely get into that, feed into this, learn about the Alice population, talk about the Alice population. The more conversations that you have about the real life issues and struggles that people are facing, the more of a level of understanding that we all are pretty much on the same page as to what's going on in our country and in our state. So continuing that conversation, continuing that advocacy. I'd also say, pushing out 211. Connecting people to 211, letting them know that this is a viable resource out there that can help this population get connected to information and resources helps. It's a way to extend that olive branch to your community and say, we are all in this together. So let's talk about some of the things that are happening and let's connect people to the information and resources that are available. And then, of course, I always have calls to action going on. So if you see in the chat, there's a link at the bottom. We always have calls to action. There's one going on for earned income tax credit, for PA 211 funding, and for our overall general support of United Way public policy priorities.
So this is going to be our last call for any questions. If you have anything that you've been holding on to, now is the last chance to kind of put it in the chat and have it in front of our excellent panelists. I will say we have Gail here today, who's one of our local United Ways, who's done a lot with the Alice report, but there are tons of United Ways that have done really great things. United Way of Lancaster has done great things through their VITA program, which really helps with Alice families because a lot of people who are Alice fall within the VITA and free tax guidelines. I recently noticed that your VITA program in Lancaster had moved up in terms of income, so that a lot of Alice families really fit into your VITA limit this year, which is great. We have also seen people doing revolving car loans to help people get access to transportation. If you were at the DEI session before this, Adrienne was from Columbia and Montour was at the DEI session. She does a lot of great things with our revolving car loan program to help people get access to better jobs and better paying jobs in her community. So I'm not seeing anything in the chat in terms of questions. So do either of you have any closing remarks you want to make about Alice and Alice in your community?
I just want to thank everyone for joining us today, and definitely a thanks to Rebecca, Amanda, and Sarah for putting all this together. But I just encourage you to use 211, keep pushing it out, as well as the Alice report. It's a great reference tool for us to have. So just keep using the products, great products. And I'm here if you have any questions afterwards, you can just shoot me an email.
Yeah, thank you. Thank you all for participating in this. The questions that were coming in were amazing. It shows that you're really engaged in this and that it is resonating with you all. And as the kind of lead on our Alice project, that excites me because I do think that talking about Alice, again, it resonates with so many people. You can also, reach out to me at any point if you have questions about Alice, if you would like me to give presentations to any community groups regarding Alice, I'm happy to do that. And I can also cater the presentation to whatever interest that you have regarding Alice. So it could be housing specific, food specific, mental health specific, whatever you feel or need.
Thank you guys so much for attending and being our excellent panelists. Thank you so much, Gail and Rebecca. This was really great to moderate. I really had a lot of fun and joy and seeing everybody so passionate and having such excellent questions. So thank you, everyone. And I hope that you have a great rest of your 211 day.